The following paid commercial program is sponsored by Secours Health System. WNIS Radio and Sinclair Communications do not endorse or warranty any statements or claims that are made, or products or services that are offered by this sponsor.
That's right. Welcome, of course, to Ask the Expert right here on AM 790 WNIS. And get ready for a very informative hour on one of the most important topics out there, your health, men's health. And we have our guest in here with us for this hour, Dr. Paa-Kofi Obeng, a doctor of osteopathic medicine with Secours. And, of course, we'll have plenty of information to share with you as the hour goes along so that we can all hopefully better ourselves as we, all want to live much longer and fuller lives. So if you have any questions regarding men's health, feel free to call us. There is no reason to be shy. The phone number is 627-7979. That is 627-7979, or toll free at 1-888-756-7979. There is no dumb question to ask. The only way to learn is to ask. So welcome to the WNIS studios, sir.
Lee, thank you very much for having me.
Glad to have you here. I figured we could start off by just kind of introducing you to the audience a little bit. We know that you're a smart fella as you come from the Ohio State University. But tell us a little bit about yourself.
Sure, Lee. Thank you very much again for having me on the air. I did go to Ohio State University for my undergraduate degree, which I got a Bachelor of Science in. I also received my Master of Public Health there. For medical school, I went to Ohio University College of Osteopathic Medicine and graduated in 2010 and wrapped up my residency in 2013.
So sometimes a lot of the titles that doctors have, of course, we know MD, we know simple ones like that. Sometimes they can be a little bit confusing.
Sure.
What does it take to be a DO, and what are the areas that you specifically, what do you specialize in?
Sure. I specialize in internal medicine. So DOs and MDs, the main difference is a philosophy. DOs have more of a holistic approach. Not that MDs don't, but the training is incorporated your first couple of years. You also learn something called osteopathic manipulative medicine, that you use your hands to help treat patients, in addition to learning your basic physiology, biology, and anatomy as well.
Interesting. So osteopathy is much different from normal medicine in a sense that it's just kind of an alternative way of...
No, actually it is more mainstream now.
Okay.
You will notice that a lot of physicians, even in the hospitals, you can't tell the difference between a DO and an MD. We both do residencies, we both do fellowships. Sometimes actually you have both MDs and DOs doing fellowships together.
Interesting.
Yeah.
So if you're listening out there, as I mentioned, you can call us at 627-7979. And I know that I said, don't be shy. There's no reason to be, but sometimes we are shy. So where can people go if you're unable to call us this hour? Where can they go to find out more about you and Secours?
Sure. My office is located on Bridge Road, 2897 Bridge Road in Suffolk, Virginia. I practice at Nansemond Suffolk Family Practice. Our number there is area code 757-484-7248.
Say that one more time?
Sure. It's area code 757-484-7248.
All right.
Yeah, right. And our website is goodhelpdocs.com.
All right. Well, I tell you what, why don't we just dive right into it? And then at any time, feel free, if you're out there, if you'd like to call us and interrupt, 627-7979. Figured a good thing to talk about would, of course, be what are the top health concerns that men have.
Sure. The top health concerns that men have, it kind of varies depending on their age range. So typically young men more worried about things like depression, suicide, things like that. Whereas older men, of course, worried about high blood pressure, prostate health, high cholesterol, those types of things. Generally, I tend to see older men, and their concerns are a little bit different from younger men. So for men, basically, it is more to do with chronic health issues the older you get, and for younger men, more issues with acute problems.
Do you have any insight as to why it is that younger men are at higher risk for what they are at risk for? Like I would say accidents or...
Yeah, a lot of it has to do with kind of like a cavalier attitude. Not that all young men are cavalier, but the fact that we tend to have more of a carefree attitude the younger we are, and become more conscientious, I should say, as we get older. So you're more concerned about car accidents. Typically, you'll see more of the car accidents with the younger population, suicides, things like that.
It's almost as if younger persons have this sense of invisibility. Or invincibility.
Invincibility, yes, that's true. Unfortunately, that we think we're bulletproof. You know, you go to sleep at 2 a.m, wake up at 6, go about your business. You think, oh, I can take over the world. Yeah. But when you hit 30, it's like, oh, you start creaking.
You can't do that anymore.
Yeah.
Your body starts to catch up with you.
Exactly.
One of the things that older men hear about a lot would, of course, be prostate cancer.
Right.
And can you talk a little bit about, I believe it would be PSA screenings.
Correct.
And some of the recommendations related to that?
Sure. PSA stands for prostate-specific antigen. It's actually a blood test that we use to look for prostate cancer or the signs of prostate cancer. Currently, the United States Preventative Services Task Force, they do not recommend it. What they do say is having a good conversation with your patients to talk about the risks and benefits associated with having the test, false positives, and so forth. So it's really up to the individual provider to decide whether or not to do PSAs on their patients. So it's for me, I use it because it's a good marker. It gives me a good gauge as to patient's prostate health.
What are some of the risks of the test?
Some of the risks of the test are things like false positives, where your PSA might be very high, but in fact, you don't have signs of prostate cancer. The next step after that typically is going for a biopsy, and the risk, again, is bleeding, complications from doing a biopsy. So if you do a PSA on somebody, comes back high, do a biopsy, and there's nothing there, you risk, you put the patient at risk for all the complications associated with the biopsy.
But usually this is a rare thing.
Yeah, it's a rare thing, yeah.
And why is it, at least in my experiences, it is very rare to see a guy go to the doctor as a sort of preemptive strike, I guess you could say. Yeah. We tend to not go unless there's something on our bodies that is already broken
right.
and it needs quick fixing.
Right.
If it's not broke, don't fix it mentality. I mean, that applies to a lot of things.
Yeah.
Maybe, I don't know, working at your house, if something, a object of yours, if it's not broken, don't mess with it. But why is that so harmful when it comes to the field of health?
That's a good question, Lee. The reason why it's harmful is because a lot of these things you don't see until it's too late. Things like high blood pressure over a long period of time that's uncontrolled, diabetes, high cholesterol, all these things can come back to bite you the longer you push them off. So it's very important for you to get screened early on so you can prevent these things and treat them before they become problems down the line. I've had episodes with patients who've never gone to the doctor, and then by the time you see them, they're a wreck. Their cholesterol's through the roof, their blood pressure's super high, so you have a lot to fix, or at least a lot to help them to help them get to their best health. And
certainly just be smart about it. You certainly, if you have the opportunity to go see somebody, the sooner the better, because you don't want those things catching up with you later down the road, because when you become older, it could be possibly harder to treat some of these things, right?
Exactly. You said it correctly.
Really catches up with you.
You're right.
What do you think is the reason that men generally go to the doctor less? I mean, is it just part of the fact that as men sometimes we are stubborn, and
right.
is it as simple as that? Or?
Right. I think you're right, Lee. I think that's the main thing is kind of we have this attitude of being kind of macho and we can do it our own. I mean, kind of get yourself up by your bootstraps and go about your business. If your arm's not falling off, there's no need to go see a doctor. But that's
rub some dirt on it.
Right. Exactly. So, I guess it's that mentality we kind of grow up with as men. So,
and that can definitely be harmful if you continue to think that way when you're thinking in terms of your well-being. I mean,
exactly.
this is something that I would think a lot more. I mean, I do it myself too. I mean, there are many times when I should go to the doctor a lot more than I do. As a person that does have high blood pressure and issues like that, I really should be going more than I am.
Right.
What are some of the things that overall men can just do to improve their health? I mean, aside from obviously going and visiting a physician and getting medical help, but what are some of the things that really we should be trying to instill into our lives?
Definitely, there's a couple of things you can do, and that's what we as doctors are encouraged to tell our patients to is engage in lifestyle change. So what does that mean? Things like watching what you eat, making sure you don't take in too many saturated fats from things like fast food and the like, making sure you increase your fiber intake as well, making sure you get some exercise in at least 5 days a week, 30 minutes a day, making sure you definitely – I like to tell my patients to engage in activities that relax them as well, because less stress.
Right.
Stress affects your blood pressure as well.
That makes a lot of sense.
Yeah.
So, I'm sorry. Were you going to?
Yeah, and I mean, that's about it. I mean, just kind of making a whole conscious effort to live a healthier life.
So you mentioned, I was talking about high blood pressure, and of course, issues like that have very negative side effects.
Correct.
What are some things that result from high blood pressure, maybe that we're not aware of?
That's a very good question, Lee. With high blood pressure, it's called the silent killer for a reason, because a lot of times you don't know it until you find out. And down the line, things like stroke, which is the main thing you're concerned about, is a stroke. There's two different types of stroke. There's something called hemorrhagic stroke and an ischemic stroke. So basically, main difference is hemorrhagic, hemo means blood. So it means the blood pressure has gotten so high to the point where the vessel itself enlarges and bursts open, then you have a bleed in the brain. Ischemic basically means lack of blood flow or lack of oxygen, where a piece of plaque that was in the lining of the blood vessel breaks off and blocks the circulation of blood, and then blood doesn't flow to the appropriate area in the brain, and then you stroke out. So that's one of the main things, as well as heart failure down the line. Uncontrolled high blood pressure can lead to heart failure down the line as well. So those are a couple of things that are concerning it for uncontrolled hypertension.
And high blood pressure is something that shows no bias towards age either. You can have high blood pressure when you're young. You can have it when you're old.
Yes.
So all men really should. That's one thing that they should go to their doctor to check.
Correct. And we usually define that as 140/90 for their blood pressure.
Okay.
The top number is the one I primarily look at, but you want to look at top and bottom. So top number we refer to as the systolic. The bottom number we refer to as the diastolic. So the number you want to keep it under is 140/90. There are actually different stages of hypertension. Stage 1 is the 140/90 or above. Stage 2 is 160/100 or above. Pre-hypertension is typically between 120 and 139 systolic, and then normotensive is considered 120 systolic or lower.
What we talk often about high blood pressure, and you hear that, I would say, most often. What are are there equally as costly outcomes of having low blood pressure, or is that something that? Yeah.
I mean, you don't want the person to have low blood pressure either. Typically, we as physicians try not to let their blood pressure get below 90 systolic for the top number, because you can get lightheadedness and you can faint from low blood pressure as well. So. Usually in that sense, then you'd have to make sure they're hydrated to get their blood volume up.
And generally anything in the area of 140/90 is what you would consider normal?
140/90 or below.
Or below. Okay.
Yeah,
so that's about the highest it should...
Correct.
Okay.
Correct, yeah.
And of course, we know the risk factors of high blood pressure, which also is referred to as hypertension at times. Right. Obesity, diabetes.
That's right. They're all associated with it, yes. That's correct. And
cholesterol, something that we also hear a lot about. That's a growing thing in this country with the rate in which obesity really is kind of taking over. How many people does this really affect? It's a lot of people, right?
Yeah. Are you referring to more to the cholesterol?
Yeah.
It affects millions of people. Latest CDC estimate, I believe, was about like a little bit over 71 million.
A lot of people
for high cholesterol. I'm using doctor terms.
That's okay. Myself. You are a doctor. You're allowed to use that.
Hypercholesterolemia. And people are asking, what is that?
What is that?
So so it affects a lot of us. And again, you won't know it until you get checked, to get blood work to look at it.
It's not something that just screams, "Hey, I have high blood pressure."
Exactly.
You actually have to go in.
Exactly. Yeah.
And that is why high blood pressure is referred to as the silent killer.
Yeah. Exactly. You don't know until you get checked out.
It is 6:22 right now at AM 790 WNIS. We invite you to call up with your questions. The phone number is 627-7979. That is 627-7979, or toll free at 1-888-756-7979. Any questions you have concerning men's health, this is a perfect opportunity, as we have Dr. Paa-Kofi Obeng in the studio with us. He is a doctor of osteopathic medicine with Secours. This would be a perfect chance to call in. That number, once again, 627-7979. We're going to take a short break, and we'll be right back with more on AM 790 WNIS.
Roads, news, and information station. AM 790 WNIS, Norfolk.
6:27 now on the clock. It's Lee Foster, joined in studio by Paa-Kofi Obeng, a doctor of osteopathic medicine with Secours. Great to have you here this hour.
Thank
I
you.
guess we should kind of rename the show. It's not that you're not an expert, but we should really be calling it Ask the Doctor. Essentially, is what we're about to do. We've got a few callers on the line, and of course, you can chime in anytime you want. The phone number is 627-7979. That's 627-7979. The phone lines are open. We got Scott, Victor, and Ken. Victor and Ken, we'll get to you in just a second, so stay right there. We'll start with Ken in Virginia Beach. Good evening, sir. How are you? Ken,
Hello?
you there? Hey, Ken, how you doing?
Oh, this is Scott.
Oh, I'm sorry. I got a little confused there. Scott, how are you?
That's quite all right. Thanks for having me on. I'm a big advocate for osteopaths. As a matter of fact, several years ago in Atlanta, I was diagnosed with prostate cancer and went to I was diagnosed by an MD and then went through several MDs getting second opinions. And it wasn't until I went to an osteopath that basically took a completely different approach and decided that surgery was not in my best interest at that point in time. I do want to point out that that's what worked for me, so it may not work for you out there, and I'm not suggesting that you ignore medical advice. But what I did find from an osteopath is that they did slow down to look at my lifestyle and the best option. And so I would just encourage anyone out there that's going through prostate cancer to look at an osteopath versus an MD, because quite honestly, every MD that I went to wanted to cut it out right away, and it would have caused a major life change that would not have been for the better.
Okay, thank you. Thank you very much for...
As you mentioned earlier, the I guess science of osteopathy is catching on in a way, because you mentioned that I had read before, and that's why I referred to it as an alternative, only because I had read articles in which it was referred to in that way. I'm not a doctor. I don't know what I'm talking about.
Right.
But you're saying it's becoming much more mainstream, and of course it helps Scott. So.
Yeah. Basically, what Scott touched on is correct. I mean, the way of approaching is a little bit different. And actually, a lot of our MD brethren are actually learning some of the techniques we learned, too, during medical school in terms of manipulation and treatment approach. So
it's kind of spreading throughout the medical field, if you will.
Oh, yeah, correct, yes.
Interesting.
Yeah.
All right, well, Scott, thank you very much for your call. I wish you the best, man.
Sure, thank you.
Have a good weekend. We'll go to Victor in Chesapeake. Well, actually, I tell you what, we're quickly running out of time. We've got to get you caught up on all the headlines of the day from Fox News, and that's coming up here in just a few seconds. So Victor, Ken, Pete, and Greg, hang on right there, and we'll get to you in just a few moments. You're listening to Ask the Doctor on AM 790 WNIS. We are AM 790 WNIS in the middle of Ask the Doctor this hour on a Friday evening with temps expected to be around 20 degrees tonight, possibly some clouds on the way for this weekend as well. Right now, 46 in downtown Norfolk at 6:35. I'm Lee Foster, joined in studio by Paa-Kofi Obeng, and welcome back, sir. He is,
Thank you.
If you're just joining us, he is a very well-accomplished man. He's a doctor of osteopathic medicine. He's with Secours. He went to Ohio State. He's got everything, man. He's got it going on. So if you have any questions to ask the doctor this hour, our phone number once again is 627-7979. That's 627-7979. Go ahead and get them in, and we'll get you on right after we talk to Victor, Pete, and Greg. Victor, you're up next. How's it going, man?
I've just got one quick question for the doctor, and then I'll take and listen to it off the air. Regards to stress and depression, say in a 50-year-old male and above, I'd be interested in hearing what he's got to say from the homeopathic or even the herbal or whatever medicine he may recommend to help, you can't eliminate it, but help reduce it.
All right. That's an interesting question. Some of the ways that you would go after depression. Do you have...
In terms of treating depression, definitely some of the things I would recommend, again, going back to lifestyle change, would be things like taking time out to exercise. I don't necessarily recommend any particular herbal supplement. A good resource, though, for people who are interested in learning more about herbal supplements is the National Center for Complementary and Alternative Medicine. That's actually under the aegis of the National Institutes of Health. What they do is they research all the non-prescription and herbal remedies to see their safety as well. I can't think of anything, to be honest, I can't think of anything off the top of my head because I don't necessarily prescribe those types of things.
Okay.
But that would be a good resource as well. Again, getting enough exercise and time off would be helpful as well.
What is, in your opinion, what is probably the most effective way you have found in treating depression? Or maybe not that you found, but that you know of. Or
Yeah. Actually, what's recommended is more like psychotherapy. And what I mean by that is they don't necessarily have to go to a psychiatrist. They can go to a therapist and actually talk things out. In terms of people who are depressed, that's what's recommended. That would be the first step before we move on to a medication. I typically don't like to just put people on medications. I'd rather they go either to a therapist, they can talk to me. I usually will refer them out to a therapist or a psychiatrist or psychologist before we move on to that next step of medication. But you don't want to just jump on it right away.
Right. You want to make sure first before you do something like that. All right. Well, Pete, Newport News, it's your turn. How are you?
I'm doing well. I hope you all are too.
Thank you.
Thank you very much.
I have several questions. I know I don't want to hog up the show, but one of them I have is I'm not diabetic, but I have diabetes in my family.
Mm-hmm.
Sugar supplements, as far as sucralose, does it metabolize like sugar does, or not?
Yeah, they're sucrose, and they do metabolize similarly in terms of how your body breaks it down, how your body recognizes it. You want to be. It takes a while for more complex carbohydrates to be broken down than refined ones. So that's why it's recommended that you go with more complex carbohydrates. But in terms of how your body recognizes it, Pete, it recognizes it essentially the same. Do you know who in your family is your parents that are diabetic?
Well, I have uncles, and I also have a sister.
Okay. Yeah, and a lot of times, too, it could be their lifestyle. I've noticed that a lot of my patients, actually, had a young guy, too. He's a really nice guy. He's a young guy in his 30s, and he's being treated by me for diabetes, but he had the same thing. His uncle is also diabetic, too, but a lot of it had to do with the way he was living. So it's not necessarily a death sentence or it doesn't mean you're necessarily going to get it. It's one of those things that you have to be cognizant of. How you live your life in terms of the foods you eat and things like that. I think that's what a lot of the problem comes in.
Would you recommend something like a sucralose over sugar?
That's I don't see any problem with that. If you wanted to try that, if you want to try what I recommend too is low sugar foods if you can overall, or even any like low fat, low sugar type foods. I'd recommend those too.
Also, would you recommend? I take as a supplement CoQ10.
Mm-hmm.
Would you recommend taking that as a supplement?
That's perfectly fine. I know CoQ10. A lot of people use that for high cholesterol, and that's perfectly fine too. Do you have a physician that you follow with, Pete?
Yes, I do.
Okay, great. Yeah, as long as you let them know what you're taking, because a problem I have is sometimes my patients don't tell me what supplements they're taking, and that kind of messes up my treatment. But I don't see any problem with you using the CoQ10.
And would you actually recommend people actually eating foods that are on the glycemic index?
I'm sorry, repeat the question.
Would you recommend people eating foods that are on the glycemic index as far as being, like you were saying before, the complex carbohydrates and stuff?
Yeah, I think that's fine too. Anytime you reduce your glycemic index, you want a lower profile glycemic index food, so that's perfectly fine.
Okay, well, I really appreciate your time. Thank you.
Anytime, Pete. Thank you.
Thank you for the call, Pete. Enjoy your weekends. And we are taking your calls. Phone number, once again, 627-7979. That's 627-7979. Greg in Hampton is up next. How are you doing?
I'm doing okay.
Good to hear it.
Hi, Greg.
Thank you. I was calling. I got two questions about cancer and one about sugar, and I'll take my answers off the air.
Sure.
Okay, I read recently it says that every hour you spend in front of the TV each day, you increase your risk of dying from all causes by 11%, 9% increased risk of dying from cancer, and an 18% increased risk of dying from heart disease. and the average American watches 3 to 5 hours of TV a day. Should I get the answer or go on to the other one? What is that true? Is there any truth in that?
There have been some studies that a sedentary lifestyle does lead to increased risk of chronic diseases like high blood pressure and cancer. But the thing you have to remember, too, is cancer is one of those diseases that have many things. We call it in doctor talk multifactorial. Basically, there are multiple things that could be leading into it, not just a person being sedentary, but also things that they eat, their exposures, their environmental exposures as well. So, yeah, sedentary lifestyle is definitely not a good thing.
Okay. And the other question I have, I don't know if I read this or heard it recently. Is this true? Any truth in this? They're saying that 65% of cancers are caused by random mutations and 35% by hereditary environmental factors. I think that's the opposite. Is there any truth in that?
It depends on what kind of cancers you're referring to. There are some cancers that are genetically inherited, and some of the mutations do come from environmental exposures, like cigarette smoking, for example. So you get mutations in your DNA which affect your lungs, which predispose you to developing lung cancer. That's a proven fact right there. So part of it is inherited, part of it is environmental in terms of mutations that occur. So.
Okay, and the last question I wanted to ask, could you tell me how many grams of sugar is a person allowed in one day? I heard 50 grams. Is there a certain amount they're allowed in one day to have, no more?
It depends on the patient.
Like with myself, I mean, or in general, I'm saying, yeah.
Yeah. Do you and you yourself don't have any history of diabetes, right, or anything like that?
No, sir.
Okay.
I'm just curious.
Yeah, 50 grams or less should be okay. Actually, I don't know all the numbers off the top of my head, to be honest. But I don't see any problem with that. The main point is the less sugar you have, the better. As long as you don't overdo it. The better.
Okay, then. And one other question: the most serious form of cancer I heard is pancreatic, right?
Pancreatic is very It's very serious. It's very serious. It's rare, but it's very serious too.
Okay. All right. I guess that's all I have. That's all I have, and I appreciate it.
No problem, Greg. It was good talking to you.
Have a good weekend. This is AM 790 WNIS. We are doing Ask the Doctor this hour with Dr. Paa-Kofi Obeng of Secours, the doctor of osteopathic medicine. And we were talking with, before, Greg, it was, I forget his name, Pete. I'm sorry, I forgot your name out there, Pete. I'm sorry. He was talking about diabetes, and diabetes is something that can be hereditary, correct? And so can high blood pressure and cholesterol. How often is it that you see a case of somebody coming into your office and getting screened or tested or what have you for these conditions, and they have it, but they're doing everything that they should be doing? They're living a healthy lifestyle. Is it a rare thing, or does it happen commonly?
It's not that common for someone to be doing all the lifestyle things and them still having the disease. You're right. I mean, sometimes you can't outrun your genetics. I'd say maybe out of the patients I see, maybe 10 to 15% maybe would be in that category where they're doing everything they're supposed to do, and yet and still they have high blood sugars, their A1C is high, their cholesterol is still high. Then you have to, unfortunately, you do have to be aggressive more with medications. So, and
then, of course, a patient has high blood pressure, and the ways that you treat that are, of course, suggesting a better lifestyle, exercise, things of that nature.
Exactly.
When it comes to exercise, how does that factor? Is that like a major portion of it? Exercise?
Yes, it is actually. Exercise is a very good drug, I should say, in the sense that it helps in terms of lowering your blood sugars. Your insulin sensitivity goes up as well. You also have lower blood pressures too. A lot of the well-trained athletes have very good blood pressures because of all the cardiovascular exercise that they have.
Yeah,
so
you're right.
Yeah,
and of course it varies from person to person. But how much exercising should one be doing? I've heard before 3 times a week. Is that fairly?
3 times a week is a good start. Ideally, you want to do it 5 times a week. If you can do it 30 minutes a day, make sure you get some cardiovascular exercise. What I usually tell my patients is try and get some things like walking, treadmill. As long as you get your heart rate up a little bit, you don't have to be like panting like you're doing some crazy aerobics workout, but at least get your heart rate up. If you're going slow and your heart rate's not moving, then you're not really getting much out of it.
We've got Mike in Virginia Beach on the phone, and remember, you can call us up with your questions, too, at 627-7979. That is 627-7979, or toll free, 1-888-756-7979. Mike, good evening.
Hey, good evening. Got a question to ask the doc here. My daughter's epileptic. She does not have a severe form of epilepsy. She only has about a seizure a year right now under the current regimen she's under. When I ask this question, I know there's going to be a whole bunch of listeners out there that are going to think, oh, he wants to smoke pot. That's not me. The job I have, I can't do it. I have no desire to. But I know that there's a difference between what they call, CBD versus THC. THC is what gets you high. CBD doesn't. I'd like this doctor's perspective on what he believes. If I've seen reports, and just recently on CNN profiled a few epileptics with Dravet syndrome. One of the girls went from she was 3 years old, went from about 300 seizures a week or a day, I think it was what it was, or 300 seizures a week down to 1 seizure a month. So I know it's not a panacea. I know it's when people try to sell it off as it cures epilepsy, it cures PTSD, it cures cancer, they're selling the snake oil of the latter part of the 1800s. I get that. My question is, do you as a doctor see this as a possible treatment and a possible effective treatment? Part of the reason being is that we don't know if it would help my daughter because of the fact there hasn't been a lot of research on it. It wasn't until this last couple of years that they've actually found that with at least Dravet syndrome, it has shown some efficacy. So what's your take on this, Doc?
Oh, thank you for that question, Mike. To be honest, I'm not too familiar with it, but I do know the special that you're referring to. I think it was by Sanjay Gupta on CNN. Profiling weed. And actually, he's right. That they did have a profile of a young girl who actually did well after the patient's parents used a derivative of marijuana. There have been some anecdotal things like here and there certain cases. To be honest, I haven't done as much research, so I couldn't give you an honest and educated opinion about it. The specialist, I don't know if your daughter probably has a neurologist that she sees.
Oh, yeah,
okay.
And this was kind of more along the lines of, listener education.
Okay.
Because we have a new peds neurologist, and she did go over the fact that it does help in some forms. At least that's what the current research is showing.
Right.
Since you're a doc on the phone, I wanted just to find out, whether or not you had a particular standpoint, but also more to the point, if you did, and that the listeners could hear it, so that when they think about people trying to legalize it for medical use, and when people try to talk about giving it to kids with epilepsy, we're not talking about giving it to a 3-year-old and giving them a joint with a roach clip.
Right, exactly.
Choke up, Tommy.
Exactly.
That's not what we're talking about.
Exactly. I know exactly what you're talking about. Yeah. Okay. Yeah. I to be honest, I wish I could give you a better answer than that, but I need a little bit more information. I need to do more research myself before I could give a good answer.
Okay. Well, I thank you very much for your time,
sir,
and you'll have a beautiful night.
You too, Mike. Thank you.
Well, there is a sign of a good doctor. If he's not sure, he won't pretend like he's sure. He'll give you an honest opinion and say, hey, well, I myself I'm not even familiar with it, so, If you want to call us up, any questions for Ask the Doctor this hour, 627-7979, 627-7979. We're going to take a really quick break, and we will be right back with more of your questions right here on AM 790 WNIS. Final few moments left in Ask the Doctor. If you can sneak a phone call in there, the phone number is 627-7979, 627-7979. If you do it right now, we may have enough time to get you on. We do have Brian waiting in the wings, though. We'll get with him first. Brian, how you doing?
Hey, thank you for your show tonight. Man, first time I heard it, I love it. But bear with me now, because I had a major stroke, and I would like the doctor to explain to everybody the symptoms, because I'm losing my mind, my memory, but things are working out, and
good.
I just forgot what I was thinking about. But okay, let the doctor talk about the symptoms of strokes.
Sure.
And there's so many people that I've talked to, they don't know what the symptoms of a stroke are. So I'll go ahead and listen to it on the radio and let the doctor speak. Thank you very much.
Well, that's a good question. What are some of the signs that maybe somebody is having a stroke, and maybe some of the actions to take care of that?
Yeah, actually, I'm here. We're in the studio, and we brought an acronym here, which is actually a very good acronym. I'm glad you brought that up, Lynn. So the acronym you want to think of is FAST, and it stands for face, arm, speech, and time. So face, typically people have, they can't, their face is a little bit contorted. They can't smile or move their face as well. They have a weakness on that one side. Arm, usually people have weakness down one side of their body, usually on one arm. Speech, again, people are in a situation where they can't speak or express themselves. And time is essential because time is brain. So as soon as we know a stroke is going on, we try and rush people to the hospital as soon as possible because we can deliver medications to treat that stroke or do procedures to treat it as well.
That was a good question you had there, Brian. And you had mentioned that you had a stroke yourself. Honestly, we couldn't tell, to be honest with you. So best of luck to you. Have a great weekend. We got Betty on the line now. Betty, how you doing?
Yes.
Go ahead, Betty.
Hi.
My lab tests come back showing I have diabetes, but I don't have to take any medication for it. But I'd like to get rid of the big belly.
Okay. So how you're asking how to do that?
How do I get rid of it?
Okay. That's a very good question, Betty. Again, I don't know. There's a couple diets out there. There's an 1,800 calorie diet that the American Diabetes Association has. There's also a 2,000 calorie diet. And that's typically what I recommend for my patients to start with. The portion sizes are another thing too. You don't want to have a large plate. And there's a good resource called myplate.gov, which gives you a good portion sizes, how your plate should be divided by meats, carbs, vegetables, and so forth. Those are good resources. So always start with what you're eating. Next thing would be trying to get out and walk. I know I don't expect you to run a marathon, but at least being active, doing some light walking, jogging, or even using a stationary bike would be helpful too. Those are the main things you want to start out with. You don't want to start just going crazy. You want to start basic before you move forward.
And stuff like that can be good for your mental health as well.
Exactly.
A nice walk around the neighborhood can maybe clear your head, and you can have some time to think about things. Maybe if you've got a dog, take the dog with you too. It's good for them.
Exactly.
There's a lot of good that can come from just getting off your butt, off the sofa, and stop munching on those potato chips and things of that nature.
That's right. We all need to do that.
That's right. Betty, thank you for your call. Have a great weekend, okay?
Thank you, Betty.
Thanks for your advice.
No problem.
It's AM 790 WNIS. A couple of minutes left with Dr. I'm drawing a blank here. I'm sorry. I'm so sorry.
Okay. That's all right, Lee.
What is your name?
Dr. Obeng. Dr. Paa-Kofi.
Thank you, Obeng. I'm sorry. I feel like such an idiot right now. I forgot your name.
It's late in the day.
It's been a long day.
Yes,
Got a couple of minutes left, and one of the things that we really wanted to stress while we were here is preemptive care.
Yes.
Don't wait around until you've got an issue.
Exactly. And that's the important thing. I'm glad you touched on that point, Lee. That's the important thing. Prevention is very good. It's very important. The earlier we catch things, the better the outcome. So things like the high blood pressure, which we mentioned earlier in the show, the high cholesterol, the diabetes, all those types of things. We catch those earlier, the better it is. We can treat those early, whether it be with lifestyle change or with medications. We prefer the patient do lifestyle change first with a lot of these chronic diseases, but if need be, then we have to use medication. But that's the main thing, is getting ahead of it, and that way you'll be healthier for it.
How can people get in touch with you? They want to know more.
Sure, they can get in touch with me. They can go on our website. It's Good Help, GOODHELP, docs.com. Or they can go to Nansemond Suffolk Family Practice. That's in Suffolk. And our number there is area code 757-484-7248. Even though it's family practice, I am the only internist there. So.
All right. Thank you for this hour, Doctor.
Thank you.
And apologies once again.
No problem, Lee.
It's good to meet you. You're a very smart fella.
Thank you.
AM 790 WNIS.
The preceding paid commercial program was sponsored by Bon Secours Health System. WNIS Radio and Sinclair Communications do not endorse or warranty any